What is vascular dementia? Well, in a nutshell, it's a type of dementia that happens because of issues related to blood flow to the brain. Join me for today's episode to get the skinny on what vascular dementia means. Welcome back to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse practitioner, and I wear a lot of different hats in my work, including hosting this weekly podcast to bring you news and information on aging, caring for someone living with Alzheimer's disease, and a wide range of topics that I hope will help move us towards becoming an age-friendly world. Because when things are age-friendly, they're friendly for everyone. So if you like the podcast, the best way to help me grow and support the podcast is to like it, share it, and leave a review in whatever platform you've tuned in on today. Because no matter how old you are today, we are all aging, and these issues are going to become increasingly important. If you're a millennial, there are things that need to be in place when you reach the age of 65. So we have about 20 to 25 years to get these things in place to help you age with the support and choices that will help you, just like the people that are 65 today. Your likes, shares, and reviews help get the information out to help more people dealing with these issues. But right now, let's get going on this week's episode. Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Dr. Melissa Batchelor, and I'm a nurse practitioner, and I've been caring for older adults and their families for over 25 years. So before we dive into today's topic, I wanted to share a few of the different ways that you can connect with me. First, you can subscribe to the podcast below if you haven't already, from whatever platform you've joined on. And if you like the episode, please leave a comment, like it, and share it with someone that you think it might be beneficial for. You can also go to my website, melissabphd.com, and you can sign up to be part of my weekly newsletter to get the latest news and information about courses that I'm developing, as well as how to join the HYSU membership site. And that's where I've taken all of my podcasts and organized them for you by topic rather than having to scroll down a gazillion thumbnails to find other podcasts that I've done that are related. And the last way is that you can join my Facebook group. It's called, the title of the podcast is Getting Old, Moving Towards an Age-Friendly World. And I'd love to see you there. So now let's dive into what we're going to be talking about, which is what is vascular dementia? Well, vascular dementia is when you aren't getting enough blood flow to your brain. It's the second most common type of dementia. So it occurs in about 15 to 30% of all dementia cases, and about 5 to 10% of people that have vascular dementia, that's the only type that they have. And I've done other episodes, one on Dementia 101, where I talk about the 5 most common types of dementia and how they're similar and how they're different. So you're welcome to check that out as well. But about 5 to 10% of people who have vascular dementia, that's the only type that they have. And the risk of developing vascular dementia increases with age. So what are some of the other names that you might have heard for this type of dementia? Well, in the past, it was called multi-infarct dementia because it was thought to be related to several small strokes. But now the name has changed to vascular dementia to reflect all the different conditions that can impair the blood's ability to get to the brain. And more recently, providers have also started using the term vascular cognitive impairment. So you may hear that. But any of those terms are the same when you're talking about a diagnosis that is related to a vascular cause. So what are the symptoms of vascular dementia? Well, they can appear very suddenly, or they can be very subtle and gradually get worse over time. But people with vascular dementia typically have a lot of different cognitive problems that include poor memory. And some of these other problems include aphasia, which means you're having trouble either understanding or expressing words, apraxia, which is the trouble with moving your body or with coordination, agnosia, which is the inability to recognize things or people. And then you'll also have problems with executive functioning, which is the ability to plan and execute an event like getting out of the house for the day. A person experiencing this type of dementia may also have delusions. They could be confused or they can get really agitated. They might have trouble with their bladder or have other urinary problems, as well as memory loss. But this tends to happen at a much later stage than it would for someone who just has Alzheimer's disease. The symptoms that we notice first with vascular dementia are more neurological because that's kind of what your brain does. It drives your whole system. But these problems are going to be like exaggerated reflexes, walking imbalance, and muscle weakness in the arms, hands, and feet. And sometimes the first symptoms that we're going to notice are going to be changes in behavior in addition to the memory problems. And for a lot of people, these symptoms make it really difficult to hold down a job, to do things around the house, or maintain their social relationships. One thing that's different about vascular dementia is that it typically advances or progresses in an irregular but a stepwise fashion. So that means that the person is stable for a period of time, and then they might have another little stroke and they're going to get much worse, and then they stabilize again, and they kind of alternate in this little stepwise fashion. And when you compare that trajectory to someone with Alzheimer's disease, that's typically more of like a slope or like a gradual downward progression. So what causes vascular dementia? Vascular dementia can be caused by a narrowing or a complete blockage of blood vessels to the brain, which deprive the blood cells of the oxygen and the nutrients that they need to function properly. And a lot of times this damage is permanent. But not everyone who has a stroke ends up having dementia. But about a third of people who have a stroke do develop this type of dementia within about 6 months. And in some cases, vascular dementia can show up following several small strokes and that occur over time. Or it could happen after a single major stroke, which is sometimes called post-stroke dementia. So anytime you have a chronic health condition like high blood pressure or diabetes, both of those cause narrowing of your blood vessels and gradually over time can lead to vascular dementia. Other things that increase your risk factors include high cholesterol, smoking, being male or African American, having atrial fibrillation, or a family history of cardiac-related events. So how is vascular dementia diagnosed? Well, if you're concerned that you or your loved one have this type of dementia, you still need to get a complete diagnostic workup like you would for Alzheimer's disease. And that's because you really have to rule out all the other possible causes for your symptoms. So your healthcare professional should ask you about your symptoms, find out more about your medical history, find out what medications, supplements, and over-the-counter medications you're taking, as well as identify any risk factors, and they should do blood work. Will probably also do some cognitive screenings like a mini mental state exam or a MOCA, just to get an idea of which areas of the brain you're having trouble with your thinking. And they should also do imaging. And typically the imaging is what's going to really reveal the underlying strokes or the narrowed or blocked arteries. So these images include things like a CT, which is computerized tomography, or an MRI, which is magnetic resonance imaging, or a PET scan, which stands for position emission tomography. And sometimes they'll even order neuropsychological testing. And that is done, it's typically like a 3 to 4 hour evaluation to get a really good picture about what areas of the brain and your thinking ability and memory are being impacted. So now let's talk about treatment. So no drugs have actually been approved by the FDA specifically to treat vascular dementia. So the medications that are approved to treat Alzheimer's disease sometimes help people with this type of dementia as well. So you may be given a prescription for something like Aricept or Exelon or Razidine, and sometimes those are ordered along with Namenda. But the biggest thing with this type of dementia is going to be managing the cardiovascular problems by taking medication or making the lifestyle changes that help slow the worsening of vascular dementia. So this means controlling your blood pressure, controlling your pulse, making sure that your cholesterol is where it needs to be, keeping your blood sugar where it needs to be, and keeping your weight within a healthy limit, because all of these things impact brain health, and they also help the blood get to the brain a lot easier. If a person is having a lot of behavioral issues that make it really difficult for the people in their lives trying to take care of them, behavioral management strategies are also useful for handling some of those behaviors that happen with vascular dementia. So the last thing we're going to talk about is prognosis. So what is the prognosis with vascular dementia? There is no cure for vascular dementia because the damage has already happened in the brain and it cannot be reversed. So the goal of treatment is going to be to prevent further damages and to manage the symptoms and get the support that person and their caregivers need to do the things that they need to do every day. Life expectancy for someone with vascular dementia is highly individualized, and that's because it really just depends on the nature of the cardiovascular problems that were causing diminished blood flow in this dementia, as well as the person's age and other medical conditions. But yeah, it's basically, if you've seen one person with dementia, you've seen one person with dementia. But with this one, you do have a little bit more control because of those, the medications and the lifestyle changes that can help your brain so much. So be sure to check out my other episode about Dementia 101, where I briefly go over the most common types of dementia. You can also find those on my website at melissabphd.com. There's a lot more information there about how dementia is diagnosed, and you can find other resources for you or someone you love if either of you are concerned about your memory. So thank you very much for listening today. I hope this has been helpful information. And don't forget that you can connect with me by subscribing to this podcast if you haven't already. And you can do that on YouTube or whatever platform you've joined me on today. If you liked the episode, please like it. Leave a comment and share it with someone that it might be helpful for. And don't forget to go to my website, melissabphd.com, and sign up to be a part of my weekly newsletter. And you can also join the Facebook group. And it's called This is Getting Old, Moving Towards an Age-Friendly World. And I will see you there. Until next time. Thank you so much for listening to this week's episode. You can check out other episodes on this platform or visit my website at melissabphd.com. Thanks to listeners like you, in the first 18 months of This is Getting Old, we have reached a ranking of top 10% globally, and I cannot tell you how much I appreciate your support in making that happen. I'm also really excited to let you know that you can now work with me directly, either one-on-one or you can join one of the groups that I coach, particularly if you're an adult child dealing with an aging parent or a caregiver trying to manage the complexities of someone living with Alzheimer's disease. In the show notes, you can also find information about how to reach out and contact me directly, and I hope to work with each of you very soon as we discover and share more ways to make the world more age-friendly for everyone. My website also has information about how to contact me for speaking engagements, or if you have someone you'd like to recommend as a show guest for This is Getting Old. If you have a product or service in the aging space that you would like to advertise and or sponsor an episode, there's more information about that on my website. And you can also find books and courses that I developed and learn more about the products and services that I recommend. So don't forget, if you like the podcast, the best way to help me grow and support it is to like it, share it, and leave a review in whatever platform that you've tuned in on today. Your likes, shares, and reviews help increase my rating and my rankings, and also help other people find the podcast. I look forward to reading your reviews and hearing from you.